Hi Michael,
Hi.
welcome to BBR. I understand you're interested in contact lenses, so this appointment's really to chat about the different options that we have available. There's many types of contact lenses, and we can go through those, but it's important that we understand actually what you have in mind. Now tell me a bit about why you would want to wear contact lenses.
A couple of reasons. I work outside and do driving in my job, and I find when it's raining, I'm forever having to find something dry to wipe my glasses on. I'm having to keep taking them off, so you can get back in to drive. And the other reason is if you go off anywhere for the day, and say it starts off cloudy or it looks like it's going to be sunny, you've either got to take your sunglasses with you, which usually comes in a large case, which you can't stick in your pocket anyway, so it has to go in a rucksack, so you have to take that with you. Whereas I think if I had contact lenses, then you'd only be taking one pair of glasses with you, just the plain sunglasses.
Okay. And when you go off on these days, is there any sort of particular activities that you do that maybe are suitable to contact lens wear?
We do a bit of cycling, which I think would be better for contact wear lens, and also sightseeing. Always have this horrible feeling when you're looking over somewhere to look at some view. The glasses are just going to drop straight off, so you're looking over like this and hold your glasses on. I think contact lenses would be good for that as well.
Have you ever worn a contact lens before?
No, I've never tried one now.
Okay. And do you know anyone else that wears contact lenses?
The wife wears contact lenses. She finds them very good. So for the same reason, you don't have to take so many pairs of glasses with you when you go out. So.
Okay. And so how often would you think, you'd like to wear lenses? If you could think of, is this something more times during the week? Or
possibly if you go out, then it would be nice not to wear the spectacles. But no, I said mostly be for work.
Okay.
I said at home, you're fine. You can take your glasses off. You can put them on. It's quite easy. But I think work would be one of the best reasons.
So you wear multifocal spectacles.
Yes.
So what a multifocal spectacle is you've got your distance up here, and as you look down, you've got your reading. Mm-hmm. Okay. So we call that an alternating type of vision. You're either in the distance or you're in the reading, but you can't be in both at the same time. Mm-hmm. With contact lenses, they behave slightly differently, and most contact lenses are what we call simultaneous vision. So when we put the contact lens in, it doesn't matter whether you're looking straight ahead or looking down, you'll be seeing both distance and reading. Okay. So it's a bit like when we sort of hearing and listening. Okay, when we look around the world at the world around us, we shuffle through a library of images. Okay, so that when you look into the wall, you'll see there's a door, there's a picture, there's a window frame, and you don't actually need to see that detail. Okay, so when we put this contact lens on, it behaves a bit like that. You'll see both distance and reading at the same time, but you'll have enough vision to make out the distance clearly, and then when you come to see your close work, you can see that as well. Okay. With this type of lens, we don't know exactly how that's going to work completely. There's lots of different styles of lens, and part of today is really understanding what this first type of lens works like, how it might behave. And one of the questions I will ask is for you to rate this contact lens once we put it in and left it for a few minutes. Mm-hmm. So we'll ask you in terms of distance vision, how you sort of feel looking around out of 10. Okay, 10 being fantastic, 0 being pretty rubbish. Okay, and the same for close work. Okay, so we'll ask you to look at your phone, do things that you'd normally do. And once again, 1 to 10, and then also comfort. And the reason we ask you to give us a rating out of 10 is it tells me how it feels for you, and then I can work from that. Okay, obviously we have charts which allow us to measure what you can see from one time to another, but with a contact lens it's very important that we achieve the performance that's going to work for you. And the way that we would understand that is we do a bit today, but we then put these lenses in, let them settle, determine what we're going to have, and then we have what we call a trial period, where we'll teach you how to put the lenses in and out, and then you'll take some and use them in your environment. And the critical thing is that you'll understand how these lenses work for you. Okay, and then when you come back, we can fine tune that or change it or alter it. And you may also come back and say, well, the way that I'd like to wear lenses has changed. So we can then also look at how we then go from there. So it doesn't really matter whether at this point you're thinking you might want to wear a lens once a week or instead of glasses. We will go with what you feel is appropriate and build up a picture as we go along. Okay. The way that we do contact lenses here at BBR is we value the professional care component, because it's very important from a health point of view. Wearing a contact lens, you're putting a contact lens on the front surface of the eye. Okay, and so there is an increased risk of infection wearing a contact lens as opposed to wearing a spectacle. So obviously we want to minimise those risks by going through all the details and the safety elements of wearing contact lens, but we need to monitor contact lens use and health of your eye more closely. So what we do is we have an Eye Life program where you pay a monthly amount, a bit like Denplan, where we then see you as required, if it's scheduled or unscheduled, and that deals with all the contact lens related care. Depending on what type of contact lenses are appropriate, we then decide that second component. Now, it could be that some people wear lenses that they drop into the direct debit. Other people like the flexibility of buying them as they need to, so they keep control of that supply. There's lots of flexibility, and we don't need to worry about or finalise that at this stage. Okay, but the one thing we do is we have all our contact lenses through the direct debit of the professional care component, and it depends on the type of lens that we end up using as to what that cost will be. Okay, for example, with a multifocal daily lens, what we're looking at is £13.50 a month for all your eye care, including your examinations, and that gives you a benefit of 20% off your spectacles, 20% off non-prescription sunglasses, and all your eye examinations. When we look in the far distance, we judge distances and things like that, and because the eyes are a different distance apart, we triangulate things. So what I need to do is get you to understand, or me to understand, how your dominance works. And we have two types of dominance. We have sighted dominance and sensory dominance. Sighted dominance is what we're using to line things up, and sensory dominance is more which eye we feel we're using for that sort of primary purpose. So what I want to do first is your sensory dominance. So I'd like you to hold your hands up and create a circle, okay? And just stretch a bit further out, okay? And now if you line this up on my eye here, okay, and now if you narrow that circle down, okay, that's great. So I can see one eye now. If I get you to close your right eye, okay, you're probably out here somewhere.
Yeah.
Okay, that's great. Okay, that's fine. You can relax there. So that tells me that your right eye is your sighted dominance. Okay. Now what I'm going to do is I'm going to measure your sensory dominance. Okay, and we'll do that with some lenses. Right, so what I've done here is I've put up a prescription which relates to your spectacle prescription, okay? And what we've determined is the best vision in each eye, okay? But we've done that using both eyes open. Now what I want to do is understand your sensory dominance, okay? So which eye feels like it's using it calculate the distances more. Okay, so what I want you to do is look straight ahead, and I've got two lenses here, and what I'm going to do is I'm going to put one in front of one eye and one in front of the other eye. Okay, now they will make things a little bit more blurred than it is now, but what I want to do is understand, is it more comfortable looking at that top line with the lens in front of position 1 or position 2. Okay, that's really, so it's either 1 or 2. Obviously it will feel a little bit clearer without either of these, but that's not the answer that I'm after. So what I'm after is it more comfortable 1 or 2? 1 or 2? 2 slightly more comfortable. Okay, that's fantastic. What that tells me is when you're looking at things in the distance, you use your right eye to help with the distance, but you also sensory use your left eye. So when we come to choosing the lens that we want in terms of multifocal, it means that certain designs may be more suitable than others. So what I've done is I've dug out some lenses now which will then be a bit more suited to this dominance that you've got between the two eyes. Okay, Michael, so what we want to do now is we want to apply a pair of contact lenses. Okay. Now, when we first put a contact lens in, nothing quite prepares us for how comfortable it is. Okay, you're probably only aware of an eyelash or something like that maybe in your eye, and it's not particularly comfortable. Yet we can put a contact lens on that's about the size of a thumbnail, and actually it's a bit of an anticlimax. It's almost like it's not there at all. You might get a little bit of sensation of something being there, but it's sort of completely different to maybe what you might expect this to be. What I want to do is, at any point tell me to stop, but what I want to do is I'll show you what I do before I put lens in. Okay, so what I would do is I would get you to keep your chin straight ahead, look right across towards that side, hold the top lid, hold the bottom lid, put the lens on, look back towards me, and that lens will be on. Okay? So, this is a contact lens. So it's very sort of soft, made of mostly water. Okay, so what I'm going to do is I'm going to put this on. Okay, so chin straight ahead, look right across towards your left, back towards me, down towards the floor, up towards the ceiling, right down. Okay, and you can blink there. How does that feel?
Feels quite comfortable, yes.
Okay, here's a tissue.
Yes, it's comfortable.
Okay, sometimes when you first first put it on, there's a bit of an air bubble. So just look right across towards that side. And then back towards me. Does that feel a bit better?
Yes.
Okay, right. So shall I put the other lens in now?
Yes, please.
You probably see round a little bit better as well.
Yeah, I was just looking at the chart, that looks a bit clearer.
Okay, now this time we're going to say look across towards me. And then back to your left, down towards the floor, up towards the ceiling, and right down. Okay. There we go. Now we've put that lens in, okay. What we want to do is to let that to settle, and then to understand, how it's performing for you. So what we'll do is we'll let you either have a wander out for 5-10 minutes, or have a seat in the waiting area, whichever's best for you. And when you come back in, I'd like you to be able to sort of give information as to how you feel the vision is for distance vision for your close work. Okay, so looking at your mobile phone, just looking around, things like that, and also your comfort. So as we mentioned earlier, we'll rate that out of 10, 10 being the best, 0 being pretty poor. Hi Michael, thanks for coming back in.
Okay.
So you've been out for a bit of a wander, okay, and these lenses are settled.
Yeah.
Okay. in terms of rating these lenses, obviously we're going to ask you about distance and reading and comfort. Comfort first. Out of 10, how do these feel?
9 out of 10. They're very comfortable. You can feel that there's something there, but they're not uncomfortable. They're very good.
Okay, well, and that's pretty good, because obviously you're not used to wearing a lens, so there's always an element of slight adaptation, but that's a good starting point. In terms of the distance, looking around, how does that feel for you? Out of 10, what would you give that?
About 8 out of 10.
Okay, right. So we'll have a look at that in a minute and see if there's any improvement available. And you've got your mobile phone, yeah?
Yes.
Okay, so if you were to bring up a message or have a look on the internet...
yes.
And how does that feel in terms of clarity?
It is. That's very clear. That's as good as a spectacle, that is.
Oh, okay, great. And so out of 10, what would you give that?
I'll give that 10 out of 10.
Okay, right. Yeah. So obviously, potentially, we could maybe look at the distance component, but we need to be alert to how we deal with the reading. The reason I ask you to rate that out of 10 is really to understand how it's working for you. So that gives us a good starting point. Now what I need to do is we need to look at teaching you how to put the lenses on your eye and take them off. Obviously, when you do that at home, you're going to then be comfortable doing that in your own environment. So I'll move on and I'll get one of my colleagues to help with that. But it's been a great result today. So we'll look forward to then reviewing things in a couple of weeks to seeing how things work in your world.
Okay, thank you very much.
Thank you. Bye-bye.
Bye.